NHS 111 is a vital service designed to help patients access the most appropriate healthcare based on the urgency of their symptoms. Available 24/7, NHS 111 uses nationally clinically designed assessment pathways to determine how urgently a patient needs to be seen or spoken to by a clinician. When you call NHS 111, a health advisor will manage your call. These advisors are trained to use clinically approved pathways to assess your symptoms and provide information on the type of care you need, whether that's seeing your GP, visiting a pharmacy, going to a minor injury unit, heading to A&E, or an ambulance dispatch. NHS 111 has access to a directory of services in the region where you live, which contains a list of available health providers and the services they offer. NHS 111 and out-of-hours services, together with these other care providers, form part of an integrated urgent care system, which is designed to direct patients to the most appropriate service for the patient. This could include speaking to a clinician within our own clinical advice service, who will also review and confirm the outcome of the NHS 111 Pathways Assessment.
So when we take a call, it's really important that we get patients' information. It's one of the first things we need to do. We need to get phone numbers, addresses, but we also need the patient's consent to be able to do that and access their records. So this is really important. One of the first things that we do with people when they come into training is to do their information governance training. And one thing that we really do home in on is the fact that when they speak to the patient, take the phone number, take the address, and then make sure that we've got consent to access their records and share them.
The first thing that we ask a patient when they call NHS 111 is for their telephone number. This is so that if we get cut off at any point and need to make a call back for them or need to provide any care afterwards, we can get back in touch with them without any delay to the patient care. A typical NHS 111 call starts with the demographics being taken. This is the part of the call where we take down the patient's details. We would then launch Pathways and take a reason for the call. Pathways works in a system of ruling out conditions. When it gets to a point where it can't rule out a condition, that is when an outcome will be generated. In the section called Module 0, we would generate the more urgent outcomes for a patient, for example, an ambulance or an A&E response. If we can clear Module 0, we can then get to the body map, at which point we will choose the section of the body in which we need to assess the patient down for their symptoms. Once the patient has been signposted, we would then give them care advice and then close the call by giving them worsening advice.
GP practices' opening hours are usually from 8 a.m. to 6:30 p.m, Monday to Friday. During these hours, NHS 111 may direct you to contact your GP. Details of your contact with NHS 111 and any assessments are sent to your GP to update your medical records. Outside GP hours, we have more clinicians available to assess patients by phone and direct them to appropriate services, including out-of-hours appointments or urgent treatment centres. These clinicians consist of nurses, paramedics, pharmacists and doctors.
So 111 online is a service that you can use online, but there are exceptions to when you use it. So if you've got anyone that's under 5, you can't use the service. And also if you've got complex medical history or ongoing situation with illnesses, but it's still a service that could be utilised rather than calling 111.
The outcome of your online assessment is available to the NHS 111 service. We can contact you if the outcome requires and access your online assessment should you subsequently need to contact NHS 111 by phone.
At NHS 111, there are a range of accessibility options available to our patients. For example, if a patient has a hearing impairment, we offer a service called Relay UK, or we offer British Sign Language services where you can video call an interpreter and they can relay the questions on to us. We also have, if English isn't your first language, an interpretation service available as well.
NHS 111 is a crucial resource for ensuring that patients receive timely and appropriate care. By understanding how the service works, you can make the most of it when you or someone you care for needs urgent medical advice.